Hi, Tanesha N Lawrence, wife, mom, caregiver, and a licensed health and life insurance producer. And you're tuning in Tanesha N Lawrence Speaks podcast. And the episode today is the insurance term of the day. And a lot of people are confused about the deductible on their health plans. A lot of people have a high deductible plan, meaning in the 5,000, 10,000, 20,000 range deductible, and they're out of pocket as well. And the reason why the deductible is so high is because the premium is so low. And then also, if you get a low premium, your deductible is, a high premium, your deductible is low. But a lot of people are scared about high deductible plans. Now, the reason why I say that is because deductible is something that the insured will pay, meaning you, who has the plan, who bought the plan, will pay before the insurance company pays for whatever service that says deductible in your summary of benefits or your benefits of coverage. So what that means is you have to look into your benefits of coverage or your summary of benefits. That's what the health insurance company send you after you have enrolled into a plan. And they tell you details about what type of plan you have. It will have deductible, it will have coinsurance, it will have out of pocket, it will have hospital stays, hospital fees, office visits, specialists, everything that services that you need. It will spell out what you will pay out of pocket. And whatever service that says deductible, that is the service that you will have to pay before the insurance company kicks in. So if you're looking, open enrollment is coming up, and if you're looking through plans and you see a high deductible plan, but the premium are, in your budget to pay for, and you're very scared because that is something that you're thinking that is something that, you have to meet a $10,000 deductible before you can go to an office visit. Not necessarily, because you want to look at your office service benefits. Because you may have a $20, $25, or $30 or $40 copay. That means you only pay that copay. The deductible does not apply on that service. It only applies on that service where it spells out deductible. And some plans are different. You want to ask and seek an insurance agent or seek the health insurance company to explain how the benefit works before you enroll into a plan. So you want to be knowledgeable on what type of plan that you have and what you're getting, because you may just, overlook a plan because it has a high deductible and you think you have to pay that deductible first before you can receive services. So again, you may have a $10,000 deductible, but to go see your OBGYN or a podiatrist or dermatologist, you may just have a $45 copay. And if it doesn't spell out deductible, now some plans have deductible plus coinsurance, but today we're just going to focus on deductible. Deductible is something that you will pay before the insurance company will pay anything. And once that deductible is met, if you have a coinsurance, meaning you and the insurance company are now sharing the cost. That's why it's called coinsurance. Now you're sharing the cost. Whatever your percentage that it states on your summary benefits, that is what you will pay. And then the rest of the amount the insurance company will pay for that service of the allowed contract rate of what they agreed upon with the doctor or the hospital. What's the allowed contract rate specifically of that services you had done. So the deductible is something that you will pay for before the insurance company will pay for any service. But it only applies to the service it spells out deductible next to. If you see copays or coinsurance, and with your particular plan, it doesn't say deductible next to the service, that means you pay for that copay or that coinsurance. The deductible does not apply on that specific service. So some plans copays apply to office visit specialists. But when you get a surgery done outpatient at an ambulatory surgical center or a hospital, it will spell out deductible plus coinsurance. So that's when your deductible will kick in. Say you get a hip replacement and it is $20,000 and your deductible is $5,000, then, $5,000 is your responsibility. And then it goes to your coinsurance. We'll say you have a 20% coinsurance and the health insurance pay 80%. So you will pay the $5,000 plus 20% of what's left over. And then whatever is left over, the health insurance company will pay for the rest because that's the allowed contract rate. If that makes sense to you, I hope it does. Because I want to break it down. I know it's a definition out there what deductible is, but I want to break it down where you can understand it because it doesn't explain details about just because you have a high deductible, it doesn't mean that you can't get services done paying a copay. You have to look at your benefits. I will suggest that you seek a care consultant or a care advocacy or advocate to look over your benefit plan with you. I do have a company, protectioninplace.com, where you can set up an appointment and a specialized care consultant will look over your plan that you have and explain and help you understand what type of plan that you have. And if you have a high deductible, if you can go to the doctors and use, because if you haven't had insurance in a while, and a lot of people on the Affordable Care Act haven't had insurance, so they really don't know how to maneuver around this health insurance process. So that's why I created Protection in Place, because you want to protect, yourself, your family, and your legacy, and especially your money, because money is important if you work hard for it. And you want to make sure that you're maximizing your benefits. Anything that you have, you want to make sure that you maximize it and that you understand it and understand what you have, because you just don't want to have stuff, like car insurance. Like I'm pretty sure a lot of people look over, and they really don't read the contract. Same with home warranty. They get the home warranty and they don't read the ins and outs. So when you need services and they're not covering it, or you have this upfront money you have to pay, you're like, wait a minute, why I have that? You just don't know. Or I like to stay educated and knowledgeable on what I have. And if I don't understand it, I would seek professionals, right? So I have been in the healthcare industry for over 15, 20 years, working for major healthcare companies. My last position was a care advocate in the care consultant department. And you may say, well, why are you not there now? Because, I take care of my mom, and it was just a decision that was hard. Either I work and can't get off and take care of my mom, or I go take her to the doctors and also take care of her when she's ill, because it's on and off. Or I help people the way that I want to help them without being restricted, but professional, and to help them understand what they have. So I really believe like this is what God has put in my heart to do, and to help you understand your health insurance benefits, life insurance benefits, because I am licensed for health, life, ancillary products, meaning vision, dental, health, and dentistry. But I just shoot these different episodes, different topics. And today's episode is an insurance term, and that is deductible. And again, that is something that you will pay before the insurance company will pay, based on the services that spells out deductible. So if you see on your summary of benefits or your benefits of coverage, D as in dog, E as in elephant, D as in dog, that stands for deductible. If you see that near your office visit or next to your primary, it's going to say primary care or specialist care, and you see deductible, then yes, you will have to pay deductible, not the $5,000, because based on the reason why you go in, each CPT code or diagnosis code has its own contracted rate. So if you have a $5,000 deductible and you have a plan where you have to pay a deductible when you go see your primary care doctor, if it's not a preventative service visit, you're not going to pay $5,000. You're going to pay the allowed contract rate based on that service. So say if you go in for a sick visit and based on the procedure code that they put on why you came in, say the total bill is $100 and the allowed contract rate that your insurance company and the doctor shook hands on, that they agreed upon with this procedure code, this is what the insurance company say we're going to pay, or we're going to allow if my members are going to pay. So the total bill is $100. The allowed contract rate is $75. $75 is what you're going to pay, and that's going to go towards your deductible, not the total bill. Since they are contracted and in network with your insurance company, meaning that they accept your plan and they are in network with your plan, they have to accept the $75 and they have to write off the $25. They cannot balance bill you, meaning they cannot bill you the balance of what's left over because they're in network with your health insurance company. So I hope that makes sense. So let me just explain it again. If you have a $5,000 deductible and on your summary of benefits or your benefits of coverage states under your primary care or specialist doctor visits deductible, that mean for that service, each time you go, you will have to pay towards your deductible until that deductible is met or the out-of-pocket max is met. So say you go in for a sick visit and the total bill for that day was $100, but they are in network with your plan and your insurance company. The allowed contract rate that your insurance company and the doctor shook hands on is $75 for the procedure code that they submitted. So $75 is your responsibility. $25, what's left over, your doctor will have to write that off, mean they cannot bill you. You will not see it and they will write it off. But they cannot balance bill you because that is the contract agreement that they have with your health insurance company, that they can't come after you over the balance that's left over. So high deductibles are high, but you have to learn how to maneuver around your benefits to get the maximum service. So that we're going to talk about today is just deductible. And I hope you understand. If you don't, let's comment, go to protectioninplace.com, click on question, subscribe so you could learn more and have more understanding. Also, you can go to Protection in Place on Facebook, but I suggest that you go to the website so you can submit your questions, comment on this episode to let me know if it helps you, what type of questions, so I can do episodes based on what you need and what you want. And it will be able to be very valuable for you, and it will help me understand what is needed. So I'm here to serve you. I have experience in healthcare, and my journey has been a journey taking care of my mom. So I am a caregiver, so I understand that side as well, the patient side. So I'm not all about selling policies. I have the experience on what patients need, how they maximize their insurance, because insurance could be high. It can have a high premium. However, you need to know how to maximize the benefit. What insurance plan has the most value to you, where you can use it and feel good about it, that, I have this good plan and this is how I use it. And it's a lot of different ways in understanding legally. I'm not trying to show you anything illegally, but I'm just trying to give you education and understanding. So I do thank you so much for tuning in. This is Tanesha N Lawrence Speaks podcast, and you can catch my episodes Monday through Friday, 6 a.m. However, with the insurance term of the day, you can catch the podcast on Fridays at 12 p.m. Okay. So again, comment below, visit protectioninplace.com, click on insurance and submit your questions, and let me know, how can I help you? How can I serve you and be a service? And also, if you need a care consultant, a specialized care consultant, set up the appointment so you can have a consultation where a specialized care consultant or a licensed insurance agent can look over your policies and see what you have and just help you out. I hope this helped out, and I hope you have a wonderful, great day. And again, this is Tanesha N Lawrence. I'm a wife, mom, caregiver, and a licensed health and life insurance producer. And don't forget to go to protectioninplace.com, submit your questions, or set up an appointment for a specialized care consultant to call you and also guide you and advise you on what type of plan you have or what type of plan that you're looking for. You may be looking for a plan, don't know really what plan that's out there. Let us help. Have a great day. Hi, Tanesha N Lawrence.